One of the top symptoms of the list of 100, I believe it's 110 symptoms from the virus, is hair loss. I had COVID last March 17th, and I started noticing my hair loss the first part of July.
34 million people were infected by COVID-19 in the United States, and 2.3 million people were from Florida.
I lost 75% of my hair. I was devastated, I was scared, I was crying. It was a horrible feeling.
In my practice, over this past year and a half of the pandemic, we've seen a huge amount of hair loss. And that hair loss could be triggered by the virus itself, COVID-19, or even just the stress of the lockdowns.
Sadly, Ann Reen isn't the only COVID-19 survivor suffering from hair loss.
I start experiencing my heart racing, cognitive issues, and then months later is when I started experiencing the hair loss and change to my hair texture, quality, density, and all of those things.
Telogen effuvium, it's called, which is the actual name of the hair loss in the third stage. There's 3 stages.
There are a number of different stages each hair follicle goes through, the anagen, catagen, and telogen phase. And it's important to understand these phases because if you're seeing hair shedding, you need to know that that might be a good thing and that might be a bad thing.
Once you have COVID, 2 to 3 months down the road is when this hair loss starts. I've talked to people who 8, 9, 10 months out, and I'm 15 months out right now, are still having problems. When my girls saw me, they cried. I thought I'd make the best of it by wearing wigs.
It caused me depression, to be honest.
There's going to be a whole new batch of people coming up in 3 months of the people who have COVID now. And they're not going to know what's going on unless we get the word out there.
COVID-19 is probably the likely culprit of why hair follicles seem to turn off in that time after the fever, and for some of these long haulers, for many, many months on into the future.
What can I do with this hair loss, with these chunks of hair that are falling out?
What can I do after experiencing something like hair loss, whether it be in the wake of COVID or just in general?
One of the treatments that we've had great success with when it comes to COVID-19 hair loss or post-febrile telogen effluvium is PRP, platelet-rich plasma, that essentially uses your own blood platelets to trigger hair regrowth. What we do is we take a small blood sample, we spin out the platelets. That means we use a centrifuge to separate the formed components and create a platelet-rich plasma, which will then re-inject back into the scalp.
Because various researchers and clinics use different preparations, session intervals, and injection techniques to administer PRP, its effects can vary.
That's the trouble with this COVID virus. It affects everybody differently.
Even celebrities like actress Alyssa Milano are experiencing severe hair loss after COVID-19.
This is my hair loss from COVID-19.
Injecting someone's blood platelets into their scalp isn't the only aspect of the procedure.
You can't do PRP without the microneedling. When a microneedling process is performed on the scalp, the platelets that we placed into that area see that micro trauma as a wound, and then they start to do their business. They release the growth factors which calls in the stem cells and creates new blood vessels and activates the fibroblasts, the wound healing cells, and also stimulates the hair follicles all at the same time.
To know that there's something out there that is available that could really, really work, I think it's a good thing.
PRP therapy is cleared by the FDA for use in orthopedics, but it's considered off-label for skin and hair procedures.
When you get to this stage, you want to try anything.
PRP treatment, within about 90 days, you start to trigger hair regrowth. Those results can continue to last for 10 to 14 months.
I still have about 35 to 40% hair still needs to grow back.
If you don't measure the baseline platelet concentration, then you will never identify someone who has a little bit of lower platelets in their bloodstream, and therefore you're going to be providing a weaker PRP.
The price for PRP typically ranges from $1,500 to $3,500 for the initial 3 treatments.
I still have medical bills from the COVID. I don't want to do another bill.
I would love to have it, to be honest, but it's something that in my case would be very cost prohibitive.
The question remains, Do COVID-19 survivors have a shot of regaining their precious locks despite not doing a PRP hair treatment?
Whether it will go back to the way it was prior to COVID, I'm honestly not sure.
It's not coming back like it should. And they all stemmed from having COVID.